Hello and welcome. Today we're diving deep into a rare but fascinating topic, cardiac fibroma. Join us as we explore this unusual heart tumor, understanding its origins, effects, and how it's managed. The precise cause of cardiac fibromas remains somewhat elusive, but it's generally considered a congenital condition. This means it's present at birth, developing during fetal development. Genetic factors are thought to play a role, although specific genes haven't been definitively identified. In short, it's not something you catch or develop later in life, but rather a result of how the heart formed in the womb. A cardiac fibroma is essentially a benign, solid tumor composed of fibrous connective tissue that grows within the heart muscle. Its location and size are crucial to understanding its effects. These tumors often arise in the ventricles, the heart's main pumping chambers, but they can appear elsewhere. As the fibroma grows, it can obstruct blood flow, disrupt the heart's electrical conduction system, and interfere with the heart's ability to contract effectively. This interference can lead to a cascade of complications. Cardiac fibromas are rare, accounting for only a small percentage of all primary heart tumors. They are most frequently diagnosed in infants and children, typically under the age of 10. Because of its congenital nature, it is equally prevalent across different geographic locations and ethnicities. Statistical data on exact incidence rates can be difficult to obtain due to the rarity of this condition. The signs and symptoms of a cardiac fibroma vary depending on the tumor size and location. Some individuals may be asymptomatic, meaning they experience no noticeable symptoms at all. However, more often, symptoms manifest due to the obstruction of blood flow or disruptions in heart rhythm. Common symptoms include shortness of breath, chest pain, fatigue, dizziness or fainting, and palpitations, a feeling of a racing or irregular heartbeat. In infants, you might observe poor feeding, failure to thrive, or cyanosis, a bluish discoloration of the skin caused by a lack of oxygen. Diagnosing a cardiac fibroma typically involves a combination of imaging techniques. An echocardiogram, which uses sound waves to create a visual representation of the heart, is often the first-line test. This can reveal the presence and size of the tumor. Other imaging modalities, such as cardiac MRI or CT scans, provide more detailed information about the tumor's location, extent, and its relationship to surrounding structures. An electrocardiogram, or ECG, can help detect any abnormalities in the heart's electrical activity caused by the tumor. While cardiac fibromas are all composed of fibrous tissue, they can be classified based on their size, location within the heart, and the specific symptoms they cause. There aren't distinct types in the same way as some other diseases, but these variations influence the treatment approach. For example, a small fibroma in a less critical location might be monitored conservatively, while a larger tumor obstructing blood flow will require more aggressive intervention. Treatment for cardiac fibroma depends heavily on the tumor's size, location, and the severity of symptoms. Surgical resection, or removal of the tumor, is often the preferred approach when feasible. However, complete removal can be challenging if the tumor is located in a critical area or infiltrates deeply into the heart muscle. In cases where complete resection is not possible, partial resection may be performed to alleviate symptoms and improve heart function. For inoperable tumors, medication may be used to manage symptoms such as arrhythmias or heart failure. In some cases, a heart transplant may be considered as a last resort. Unfortunately, since cardiac fibromas are congenital, there is no known way to prevent their development. Genetic counseling may be considered for families with a history of congenital heart defects, but it's important to remember that the exact genetic basis of cardiac fibromas is not fully understood. The prognosis for individuals with cardiac fibroma varies greatly depending on several factors, including the tumor size, location, and the success of treatment. Complete surgical resection generally offers the best chance of long-term survival. However, even with successful surgery, there is a risk of recurrence. Regular follow-up appointments and cardiac monitoring are essential to detect any potential problems early. Research is ongoing to explore new treatment strategies for inoperable tumors and to better understand the genetic factors that contribute to the development of cardiac fibromas. Advancements in imaging techniques and surgical approaches continue to improve outcomes for these patients. Thank you for joining us in exploring the complexities of cardiac fibroma.